Hello and welcome to Altru Unscripted. I'm your host, Annie Bonzer, and I am excited today to be here with Audrey Lorenz, our Director of Strategy and Engagement. We are going to be talking about our 10-year relationship with the Mayo Clinic Care Network. Welcome, Audrey. Thanks for being with us today.
Thanks, Annie. Thanks for having me.
Yeah. So to get us started, can you just tell me what the Mayo Clinic Care Network is?
Yeah, the Mayo Clinic Care Network is a group of independent healthcare organizations that have come together to collaborate with the Mayo Clinic. There's 46 members across the United States and actually across the globe, so that's kind of cool. It's an international organization. And it really was, it's a way for Mayo Clinic to extend the vision of Dr. William Mayo in terms of collaborating with other healthcare providers to truly benefit all of our patients.
Very good. And how did we come to join the Mayo Clinic Care Network?
So it's kind of a fun story. We officially joined the network in 2011, so 10 years ago. But prior to that, we were having conversations at Altru about, how can we maybe connect with a larger organization from a partnership perspective, so not thinking about a merger or an acquisition or anything like that, but just how can we strengthen our connection to a bigger organization. And Mayo Clinic at the same time was actually thinking about how do they kind of do the same thing. How do they increase their reach and strengthen connections with other organizations in a non-owned kind of way? So really it was good timing, and we got together and, long story short, kind of formulated the vision of what the Mayo Clinic Care Network could be. And I'm really proud to say that we were the very first member, and I think we had a hand in shaping what it is and what it has become.
It's so crazy. It's been 10 years.
I know.
This relationship that we have. So just can you talk a little bit about how does the relationship really benefit our patients?
Sure. So that's what's most important, I think. Our experts have experts. So our patients have that direct connection to the providers at Mayo Clinic through our providers. So if there's somebody that has a complex medical condition, or if they just want that second opinion, they can connect with, our providers can connect with a provider at Mayo Clinic, and really that patient gets that expertise of the provider at Mayo without ever having to go there. It's like that second opinion from literally the best in the world, which I think patients really appreciate. And it happens at no cost to them either, which I think is a great benefit.
It's kind of just this amazing thing that works itself out in the background. Very good. So I assume that that's really helpful for our providers as well. Can you talk a little bit about that?
Yeah, so our providers have several ways that they can connect with either people at Mayo or actually just their knowledge and expertise. So they can do an e-consult, which is, what I just mentioned, that electronic second opinion, essentially, where they can get the guidance and expertise of a specialist at Mayo. At their fingertips, they have a tool called Ask a Mayo Expert, which is just a repository of all kinds of information related to, hundreds of clinical conditions. So if they have a patient that presents with something and they want to do a little research, they can tap right in from our medical record right into Ask a Mayo Expert and learn what their colleagues at Mayo would do in that situation. They can participate in e-boards, present a case, and essentially engage in a conversation with providers at Mayo about that particular case. We can use Mayo Clinic's patient education materials. And then, of course, if there is the need for a referral, then we can help make that happen too, so that our provider gets connected to that provider and makes a seamless transition for our patients to get the care they need at Mayo Clinic if that's what's required.
Yeah, very good. So if we think about our community as a whole, how can our residents across the region really see this relationship as a benefit for them?
Sure. Well, I think it gives peace of mind, maybe. Altru's always here for them, but it's Altru and Mayo Clinic. So whatever you have going on, from something simple to something a lot more complicated, you really are getting the collective knowledge of both organizations. So I think our community can take a lot of comfort in that we're working together to provide the best care that we can to our patients.
Yeah, that's a great insight. So if we think about the COVID-19 pandemic and everything we've been through with that, can you share some examples of how Mayo has been able to support us through that, our teams and our providers?
Yeah, so the one thing that we've done throughout our membership, and maybe more recently, is we really look to the team at Mayo Clinic as a resource for us. So when our leadership or our teams have questions about a topic, we have the direct line to the folks at Mayo to ask that question and see how they're handling a particular situation. So I think, using the pandemic as an example, when COVID-19 was first a thing, I think there was a lot of reaching out to understand what they were doing, what treatment protocols they were putting in place, and how they were preparing to care for those patients. And that has just continued on, even from an employee health perspective, how they're working with their team members, how we're working with our team members to make sure that everybody stays safe and healthy throughout the pandemic. I just received updated information last week from them, as a matter of fact, on some different protocols. So very helpful to have them as a resource for a number of different topics.
Yeah. I know, and our community has also had, such a desire for knowledge through the whole pandemic, and being able to share the incredibly up-to-date resources that Mayo Clinic makes available to us with our community as well through blogs or to share with our local media has been really amazing as well. So another way that relationship just shines.
They are a trusted resource for not only our patients, but also for our team.
Mm-hmm. Very good. Thank you, Audrey, for sharing your insight on all of the ways that our relationship with the Mayo Clinic Care Network has benefited our patients and our teams throughout these past 10 years. And now we are very happy to have some words from Dr. Mark Larson with Mayo Clinic on our 10-year celebration.
Congratulations on this very significant milestone, your 10-year anniversary in the Mayo Clinic Care Network. Over the last 10 years, we have seen your organization's commitment to excellence and commitment to patient care. Through our clinical collaboration, by sharing Mayo's resources and utilizing your trusted local providers, your patients have received outstanding care, and we have developed a very clinically meaningful relationship. Once again, congratulations on reaching this very significant milestone and for your commitment to your patients, your providers, and to your community.
What a difference this collaboration has made over the past 10 years. Thank you, Dr. Larson, for sharing those words. And Audrey, thank you for being with us today.
Thanks, Annie.
And for all of you, you can find more content on Altru Unscripted through our YouTube channel and social media.